All right, so let's begin by introducing our subject today and stating that effective communication is critical to make sure that there is an understanding, empowering patients and clients, and to provide high quality care and services. A language access plan can ensure that our staff members are aware of what to do when an individual with limited English proficiency needs help. Our plan, or the plan that we're describing today, can help ensure that any staff member is aware of what to do when an individual with limited English proficiency needs help. This plan identifies ways that providers of all types of services can assess their programs to make sure people with limited English proficiency have meaningful access to what is offered in their communities. Now, when we hear the term a language access plan, we must understand that nearly 10% of Medicare beneficiaries are individuals with limited English proficiency. Also, entities that receive federal financial assistance, such as Medicare Part A, C, and D, must take reasonable steps to provide meaningful access to their programs by people with limited English proficiency. Reliance on unqualified individuals to interpret medical and all other types of information can lead to misunderstanding and devastating outcomes. What is the language access plan? As a definition, a language access plan is a document that spells out how to provide services to individuals who are non-English speaking or have limited English proficiency. Language access plans should be tailored to individual organizations, but these may include similar sections that we will describe today. 5 of these sections you see on your screen. The first one is assessing the need. The second one, language services. Third one, described as notices. Then we have training, and finally, evaluation. What we're seeing on our screen right now is a basic plan, and this is what the CDC, just to mention, an institution uses for as a role for their language access plan. So as part of the needs of assessment, or the points that we see here are the number of individuals with limited English proficiency, how many do we have in our community, who are the points of contact, the levels of interaction with those points of contacts, and the stakeholder engagement. When we talk about language services, which is the second step to our language access plan, we need to develop policies and procedures, interpretation services, and also translation services. What do we need to translate? Things like notices, I speak cards, patient rights and responsibilities, the taglines, the signs. And one of the most important parts of a language access plan for me is the training of our staff. In this training, we should include frontline staff, the providers, and our leadership. And the last part of our plan is evaluation, which, to make it measurable, we should monitor complaints or suggestions. We should keep current on community demographics, and also we should track utilization of the services. Who should have a language access plan? First, organizations that receive federal funding, such as certain hospitals, health plans, community-based organizations, and others. Also, organizations accredited by entities such as the Joint Commission of the National Committee for Quality Assurance. Our webinar today will focus more on plans for individuals with limited English proficiency. This can also be utilized for deaf and hard of hearing or for a blind people, but certain things would need to change in the plan. And this is all to abide by the legislations such as Section 504 and Section 508 of the Amendment to the Rehab Act of 1973, and also Title II and Title III of the Americans with Disability Act issued in 1990. Now, this is the 4 factors that are taken into consideration when we are evaluating program accessibility. First, the number of people with limited English proficiency who are eligible to be served or we may likely encounter in any of our programs. Secondly, the frequency in which those individuals with limited English proficiency come in contact with the program. Also, the nature and importance of the program, the activity or service provided by the organization to the people that it benefits. And lastly, the resources available to the organization and the cost of language services. I want to go back a little bit just to describe each point that are described or mentioned in what a language access plan. So when we're talking about assessing the need, we should obtain information about the needs of current and prospective consumers whose preferred spoken and written language is any other than English. And this may include the number of individuals with limited English proficiency, the places in which consumers with limited English proficiency interact with the organizations, and ways in which each of these people will interact with our staff members. Secondly, the language service. This provides a description of the types of services the organization will provide, such as in-person interpretation and remote interpretation. Translations, and this falls onto the third one, which are notices. We want to describe how the organization will let its patients, clients, customers, or beneficiaries know about availability of services. Examples may include the signs that we see in organizations and also the taglines. The fourth step, like mentioned before, is training, describing to our staff members how they can get a Spanish interpreter, a French interpreter, and also how they will be able to request translation services if these are needed. And lastly, evaluation. We should make a plan for when and how the organization will monitor and update its plans and policies, procedures as well to ensure that needs are met in our community. Okay. So one of the first things that we need to do is assign a leader, someone who will take over for the plan and make sure that they oversee the organization language access plan. They maintain a database of qualified interpreters and translators so that they choose a good LSP or language service provider for their organization. They should also be responsible to train staff on how to utilize language assistance services when they're servicing the consumers. Also, they will coordinate and manage requests for interpreting and translations. Another responsibility that they will have is to manage the budget to provide language assistance and services. And here we could mention that when they're planning to have an LSP or an organization to provide language services, they would kind of hunt around and compare pricing in order to maintain their budget. And lastly, they should regularly assess and improve the language assistance program. We go back to the main points here. So when we're assessing the need, we must know the number of individuals who will be utilizing the services, rough number. There is information available which is free, and most states have this information available. This is one of the places where you're able to obtain the demographics of your area, and it will allow you to better understand which languages you might need to service. Also, the compendium of resources for standardized demographic and language data collection, provides information and resources around data collection, including race, ethnicity, and language. If the organization does not have internal data, there are public available resources that estimate the language need of those individuals the organization may most likely encounter. For example, the US Census. This information is updated frequently, and they provide language tablets for each state. Then we go into the point of contacts. Who in our organization will be able to use the services? We could start from the first point of contact, which can be a security guard. Then we have the call center staff, if we have a call center in our organization, reception area, and also the mail that we send out. It needs to be translated. And also, if we're a hospital, we want to make sure that services are available in the exam rooms for the doctors and the patients. Then we have the levels of interactions. We need to know how many times or where exactly these people are going to reach for an interpreter or to have access to our organization. It should be hotlines or information line, outreach programs, public meetings and hearings. For this, we need to determine if the preferred usage of interpreting will be consecutive. And from our experience, we know that simultaneous interpretation is the best to use when there are public meetings and hearings. Also, something that we have recently seen growing mostly is the interpreting of websites. Depending on the top 10 languages or top 5 languages that you will see in your area. Also, we want to make sure that written materials are complaints and brochures are also translated for our staff members to utilize with the limited English people that they encounter. And lastly, we see stakeholder engagement. We want to make sure that we ask for feedback from the particular users in our staff. And also we would like to get feedback from the customer. These may include customer satisfaction. How did they feel with the interpreter that they were provided? How did they feel with the process that they went through to get the interpreter? Moving on to the second, well, this is just an image of what the point of contacts may be within our organization. And I mentioned it previously. So when it comes to language services, we want to clearly understand which language services we would provide. So we would make sure that we provide interpretation that can be over the phone interpreting, video remote interpreting, on-site interpreting, or their acronyms OPI, VRI, and OSI. And if the interpretation is going to be consecutive, in which the original speaker will allow, will say 3 or 5 sentences and then allow some time for the interpreter to render in the target language, and also simultaneous interpreting, which is what we see in the United Nations and hearings, and most recently, a beauty pageant that we saw about 2-3 weeks ago. And also, do we need translation services? If you ask me, I would say you would always need translation services because you want to make sure that the written communication reaches your consumers, your clients. So we would want to translate application forms that include those for benefits, consent forms, which could be consent to treat, release of information, or consent to immunize. Also, we want to translate complaint forms, eligibility forms, financial payment policies, patients' rights and responsibility, including the availability of language access services that will be at no cost for your consumers. Important patient instructions, what they should do after they're discharged from the hospital. And these are just a few of the materials that we would want to translate. When it comes to notices, we have notices that are posted throughout our organization, and we want to make sure, like I said before, that they reach the target, that they reach our patients, they reach our consumers, and we want to make sure that they are in their target language. One famous notice that we see frequently is I speak card. I will show you an example of what Effective uses for their customers. And also this I speak card could be described as a way to identify what language an individual speaks and to identify what language interpreter you will need to request when you're calling to get services. People are able to point directly to what language they speak, and it would be I speak X language, I speak Spanish language, and then they would see it on their language, yo hablo español, for example. Patient notices. This is very important. The organization should provide notice to patients in their own language that an interpreter will be provided at no cost to them. These are very similar to the I speak cards. Patient notices contain a statement in English and a variety of languages to allow individuals, like with the I speak cards, to point to the language that they speak. Lastly, we see that taglines are another way to provide notices, and these are through printed and electronic materials. You will click a link and it will take you somewhere. And one of the taglines that we have been seeing, which is also available for public use within the Department of Health and Human Services, official for civil rights. It's if you speak Spanish, it would say it in Spanish. Language assistance services are available for you free of charge. Please call a certain number. It is important that I note now that all of this information that we're providing today has been extracted from the U.S. Department of Justice, Civil Rights Division, Federal Coordination and Compliance section, and also from cms.gov. This is what I mentioned before, what Effective uses as an I speak card. We will be more than glad to send your way if you would want to take a closer look. The fourth part of the language access plan is training. Why is it important to provide language assistance services? These are part of what we should train our staff on. Here we would mention the laws, how the laws of non-discrimination fall right into the interpreting and translation, how to effectively and respectfully communicate and interact with individuals that do not speak English or are limited to English, the organization policies and procedures related to providing language access services, including the availability of interpretation and translation services at no cost, how the staff can capture data around consumers. Do they have an app that they utilize? Are there forms that they need to fill out? And they will put the language needs and also the preferred language or interpreting that or translation if need be. Also, procedures to request and work with an interpreter. They call the 1-800 number, type in their PIN, request a language interpreter, or if there is any other process, they need to understand it clearly. Also, what type of translated information is available to users of our services and where it can be found. And many organizations, and this is the case with most of our customers, they include this training for interpreting and translation services as part of their onboarding process. They also do refresher trainings on a yearly basis, and some organizations also include this on employee reviews that they do certain dates for their staff members. Lastly, and very important, is the evaluation of our language access plan. We should monitor the organization's response to complaints or suggestions by individuals with limited English proficiency, community members, and employees regarding language assistance services that we provide. We have to keep current or up to date on community demographics and needs by engaging local public health authorities. And this is very important because we have experienced that, let's say, a group of people from a certain country or region will come to New Jersey, which is where I am currently at. And then for some reason, they start leaving. And we think as an organization that this is still a top language for us, when in reality, this has kind of switched around. And instead of French, for example, now Spanish is our top language. For this, we need to engage with local public health authorities and whatever information they have stored, school districts, faith communities, refugee resettlement agencies, and other local resources. Obviously, this is all private information, but we're able to share just the languages that particularly are more of used. We should survey staff members about their use of language assistance services, what suggestions they have to improve it, and if the services provided meet the language need of local communities. Also, we should monitor the utilization rates of the different type of languages throughout our organization. We should conduct surveys of the organization's consumers about their experiences using language access, and we should provide collaboration with two other agencies using technology, staff development, and other mechanisms to improve the services that we're able to provide to the limited English proficiency. To conclude our webinar, and just so that you all know, we do have a question moment right after this. So you are more than welcome to send your questions in the chat. We can say that without appropriate interpretation and translation services, it can be very difficult to communicate effectively with individuals that do not speak English or limited to our language, which can result in liability related to poor health outcomes, lower patient satisfaction, and violation of federal laws prohibiting discrimination based on national origin. There is also lower patient satisfaction among individuals with limited English proficiency who need interpreters but do not receive them, and among individuals who receive language services either from ad hoc interpreters or from non-medical or specific service type or untrained support staff. Our recommendation is that a staff member, if not qualified to interpret, does not go into that role. Providing high quality language access services at each point of contact is a critical component of high quality care and services. Working through the steps described can help ensure that an organization is well prepared to provide language assistance services and to care for individuals with limited English proficiency. We will be glad to assist you in developing a language access plan. If you guys have any questions or comments, they're welcomed. You're able to type those on the chat. I will allow 5 minutes for those questions to be shared or comments. This webinar will be shared with all of the attendees of today. And if you have any particular questions, or if you don't want to ask any questions here, you're more than welcome to write to me at Catherine with a K .a@effective.com. Catherine with a K .a as an apple at effective.com. And I'll be glad to target any of the questions that you may have, concerns, or anything that you would want to send our way. If you don't ask me any questions, you're a great crowd, but I'll allow 2 more minutes for questions. All right, I think we can wrap it up today then. And like stated before, all of the information provided during this webinar were extracted from these resources that you see on your screen. You're able to access them once we share the webinar, and you can again send your questions, comments, concerns. We want to thank you for your time today. Thank you for joining us, and I will be sure to speak to you soon. Bye-bye.